The impact of the coronavirus outbreak continues to evolve rapidly throughout our state and the world. During this public health emergency, the California Community College's #1 priority is to ensure the safety of all of our students and staff across our 115 colleges. The Chancellor's Office has been in frequent communication with the colleges since early February about COVID-19. We are providing information and updates from the Centers for Disease Control and Prevention, the Governor's Office, and the California Department of Public Health, particularly the guidance they have developed specific to colleges and universities. The Chancellor's Office has provided the ability for all colleges to convert in-person classes to online. Most of our colleges have made this transition or are preparing to expand online instruction. Some colleges are temporarily suspending classes and using upcoming scheduled or rescheduled spring breaks to make this switch. The California Community Colleges have long been a leader in online education, and I'm urging colleges to increase their ability to use this option during this emergency and in future emergencies. Our colleges are no strangers to disasters, unfortunately. They are working tirelessly to help their communities get through this crisis, and they will play a critical role during recovery. My office has created a COVID-19 webpage that can be found at cccco.edu. This page has materials available in English and Spanish and provides up-to-date information and valuable resources from the federal and state authorities, as well as the Chancellor's Office. Now, I'd like you to meet two of our outstanding nursing students who are working to improve public safety by sharing valuable information on how you can protect yourself and others.
COVID-19 is a new viral disease. The virus is believed to spread mainly from person-to-person contact.
There are some precautions each of us can take to help maintain our health and the health of our communities.
Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing.
If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol.
Avoid touching your eyes, nose, and mouth with unwashed hands.
In order to help reduce the spread of the coronavirus, do your best to stay away from crowds. If you have to be out in public, you should practice social distancing, which means it's best to try to keep at least 6 feet between yourself and others.
If you are 65 or older, or someone with an underlying health condition, you should isolate yourself in your home as a precaution to avoid getting the coronavirus.
Stay home if you are sick, except to get medical care.
Cover your mouth and nose with a tissue when you cough or sneeze, and then throw it away immediately. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, handles, light switches, and computer keyboards. Most common EPA registered household disinfectants will work.
If you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing, call your healthcare provider or local public health agency.
People who are mildly ill with COVID-19 should stay at home during your illness and not leave except to get medical care.
If you are sick, you should avoid public areas. Do not go to school or work.
Avoid using public transportation, ride-sharing, or taxis.
If you have a medical appointment, call your healthcare provider in advance and let them know you may have COVID-19. This will help them take steps to keep others from getting infected or exposed.
If you think you have COVID-19 or have been diagnosed with it, do not share household items such as dishes, glasses, cups, utensils, towels, or even bedding with others in your home.
Most importantly, call 911 if you have a medical emergency. Notify the dispatch personnel that you have or are being evaluated for COVID-19.
If possible, put on a face mask before emergency medical services arrive.
Thanks to our great nursing students for helping share information on how we can protect ourselves and help stop the spread of the virus. Did you know that the California Community Colleges educate 70% of nurses in California with instruction from working medical professionals, specialists, and technicians? Our community college system provides a vital pipeline to our medical workforce and helps California and the nation maintain the health and well-being of our communities. By all of us working together, we will get through this crisis.